Good morning, and thank you for attending the Centurion Technologies Cyber Risk in Healthcare webinar. Just a quick housekeeping details. We are presenting this webinar in listen-only mode, so if you have any questions, please use the chat function in the GoToMeeting to send us a question. My co-organizer, Phil Simeone, will be helping me out not only with the questions, but he'll also be running the polls for us today. During this presentation, we will have a couple of polls just to find some information out and to hopefully share some insights with all of you about how your organization is doing things in cybersecurity. With that out of the way, let's go ahead and get started. First off, let's talk about what we're going to talk about. The agenda this morning, we're going to talk about, is it just your PHI that's at risk? What are some of the top 3 threats in healthcare? What are the incentives both for you and for the cyber criminal? And we're also going to talk about some ways you can strengthen your security. Well, just so that we get started on the right foot, let's go ahead and take the first of the 2 polls. Phil, I'm going to turn it over to you to share the first poll.
Thank you, Tony. Okay, I'm going to go ahead. I'm going to launch the poll. And the question basically is, how do you rate your existing cybersecurity? And that is an interesting question to ask yourself. In today's world, with malware spreading at such a rapid rate, people are constantly analyzing their cybersecurity and trying to keep that up to date with the current threats. So I'll give about another 5 seconds for that poll to be answered. Okay, so let's go ahead and share those results. It looks like 50% of you rate your existing cybersecurity as good, and 50% of you rate it as adequate. So those are pretty much the norms that we see as well. So I'm going to go ahead, I'm going to hand that back to Tony. Tony?
Thank you, Phil. Looks like we do have a few folks that are just coming in, so welcome. We're just now getting started. And let's talk about, is there more in your organization than just PHI to lose in a cyber attack? First off, let's look at personal health information. And personal health information includes things like your diagnosis, test results, which doctor they're seeing. What we've found is that personal health information is actually quite valuable to the cyber criminal. What's happening is the cyber criminal can use this information not in the immediate time frame, but they can do this, they can hold on to it sometimes for months and use it in like a Medicare scam. So this information is very valuable to a cyber criminal. Of course, personally identifiable information such as social security numbers, addresses, phone numbers, these have been well-known useful bits of information for cyber criminals, because that is where you can start identity theft. You can use that to for various other scams as well, by using that social security number, address, phone numbers. Financial information. Most every hospital clinic out there has some form of payment. I would guarantee that everyone that's on this presentation today does take some kind of either credit card or insurance payment. So that financial information is really one of the things they're going for right then. Credit card data is something that a cyber criminal can turn around within sometimes minutes for financial gain. Intellectual property. A lot of clinics and a lot of doctors will be running different kinds of studies. They're running tests. They are using information they're gathering through their clients, through the patients, in a scientific study. Well, not only do cyber criminals want that for possibly blueprints or whatever to sell to less than reputable other doctors, but we're finding out that cyber espionage is on the rise, and intellectual property is a big target for state-funded cyber criminals. So it may be other countries that are looking to find our resources, and one of those resources is intellectual property. Proprietary processes. Every hospital, every clinic runs slightly different than each other. So one of the things that we're finding out, it is the processes also are targeted. And processes can be anything from how do you gather information from your clients, how do you process your day, how does your ER run. Any of those processes that you have, especially in a large hospital, you have an operations manual. And that's valuable to another hospital, that's valuable to anybody that is trying to put together a process. And generally these are proprietary. These are not something you want to share with your immediate competitors. And of course, probably the most important is confidence. It's patient and community confidence. When you have a major breach, the confidence that your patients have in you as a hospital in keeping them safe, especially their identity, is damaged. So what you need to do is make sure that all of the things that we're going to talk about today are used to not only help you keep PHI, PII, your financial information, the intellectual property, your processes, but really, really important is community confidence, because you don't want your communities to lose confidence in your healthcare organization. In the 2014 Data Breach Investigations Report, which is conducted every year by Verizon Enterprise Solutions, they break down the information in different categories. And healthcare happens to be one of the categories that they focus on. And theft or loss of equipment top the charts where healthcare facilities lose data. 46% of all breaches in the healthcare area in 2014, or in the 2014 study, were from theft or loss. Now, a couple of these, and I'll qualify that just the way they did, is they said that some of these were from stolen laptops. So somebody came in and physically stole a laptop, and the information on that laptop was not encrypted. They were able to get the information off there, and it was hundreds of thousands of records in one case and over 1 million in another. So this information, even though you try to protect it, you also have to think about physical theft as well. One of the other things they pointed out was that some of this loss of information actually came from old hard drives that were thrown out and not fully, all the information fully removed off of them. So when they were actually e-cycling some old equipment, there were still some bits of information that are on there that were not completely wiped out. So if you are in an e-cycling program, which I know everybody's trying to be much more green, that is a major concern you have, is make sure that those hard drives, either remove them and then have a company destroy them for you, or make sure that when you e-cycle that equipment, just do not e-cycle the hard drives. Go ahead and keep those, or store them somewhere, or actually have them professionally destroyed. The next one is insider misuse. 15% of the breaches in the 2014 data breach study were of intentional employee abuse. And that goes right to, you have a disgruntled employee that may want to just, create some havoc, or somebody who is not very honest to start with and are selling information, because, it's very easy to sell credit card numbers. So 15% of the breaches there were from intentional employee abuse. What they did say was that disgruntled or former employees were found to sometimes have access, and that they use that access to gain information even after they're no longer an employee. So you have to be very careful when it comes time to terminate an employee, or even when somebody retires or quits, because if they retire and they still weren't happy, you got to be careful to make sure that information, they don't have access to that information anymore. And third in this particular grouping was unintentional actions. This happened by sending an email to the wrong person or a fax to the wrong person. changing a setting that they didn't realize would allow somebody else to come in, neglecting software patches. You guys that are, in fact, most of you are in the IT field here, and I know how hard it is to get all of the patches that come through because there's so many of them. But some of the doorways to get in were because there was a Java patch that wasn't on, or there was obviously been several of the Explorer patches that you have to keep up with in order to close the known loopholes and keep that current so that the cyber criminals can't get in through that back door, as it would. Now let's talk about incentives. Obviously, you guys have incentives because you're wanting to keep your PHI safe, but cyber criminals have a huge incentive, and it's all in dollars. This graph here shows that it breaks it down by year and also by how much each year was, how many of these occurrences were in different dollar categories. As you can tell, obviously, the more than $1 million, there's a whole lot of them. You're talking, 25% just this year, 31% last year. And the Washington Post reported that the Center for Strategic and International Studies estimated that the world's economy lost more than $445 billion in 2014 due to cybercrime. And as this graphic shows, you will see that the top three categories there still represent 74% of all cybercrime for the 2013 data. So it was published in 2014. The most advanced economies suffer the greatest losses. The United States, Germany, and China together accounted for more than 200 billion of that total. And according to the data provided by the Ponem Institute in its study, healthcare organizations suffered a cost that ranges from less than 10,000 to more than $1 million, and the estimated average on this was $1,973,000. So you're talking about a huge, huge number on average. And the average number of lost or stolen records per breach for last year was 2,150. And it's observed that in the healthcare industry, the average cost on each one of these lost records was $188. So if you do the math there, you're talking, 2,100 records times $188. That's a price that no one wants to pay. And when we look at the graph one more time, we'll see that though the percentage occurs, the big hits are 74%, you still got to understand that the little smaller dollar amounts are still very prevalent. And this could be because they just didn't steal as many records, or it could possibly be that it was just a smaller hospital or a smaller healthcare organization. What we can take from this really is that no matter what the makeup or the number of occurrences is still rising. And even though cyber criminals are not going after the biggest of the big, it does not mean that you as a smaller group or even as a large group could still be impacted. And this kind of goes over some of the things I just had talked about, but why healthcare information is so much more valuable than any other is that every identity that's just financial is worth about $5 to $10. A medical identity, because it has so much more information, can be 50 times that. And according to the Identity Theft Research Center, 1 in 10 Americans has been affected by a large healthcare data breach. As we know, most of those would have been in like your Anthems or the Blue Cross Blue Shield. These were humongous. Some of these were 4.5, 5 million records all at once. But that number is unfortunately still increasing. So we are still seeing more and more, and it's because of this incentive that cyber criminals have, because that information that you hold in your storage is very, very valuable. Now let's look at your incentives. Everybody knows about HIPAA. HIPAA has, and the security rule really just set the standard. It's for ensuring that only those who should have access to your electronic PHI actually have the access. And part of this is the privacy rule states a covered entity must have in place a appropriate administrative, technical, and physical safeguards to protect the privacy of protected health information. HIPAA's been out for a long time. We've seen many times that we've gone through and done, added more to our HIPAA security, everywhere from not having, the sign-up sheet out that everybody can see, to encrypting our data. What happened, though, is that when HIPAA came out, it didn't have a whole lot of teeth to it yet. And that's why the HITECH Information Act came out, and it's the Health Information Technology for Economic and Clinical Health Act. This particular piece of it is actually the teeth to HIPAA. And in general, the Act requires that patients be notified of any unsecured breach, and if the breach impacts more than 500 patients or more than, then the HHS has to be notified as well. And notification will trigger posting the breach's entities and the name of the healthcare organization. So under certain conditions, local media will also pick this information up because they tend to like to present any major security breach anywhere. And in this case, they really want to see, hey, what's going on with our healthcare organizations. And when this organization is triggered, the breach is televised. That is going to do a major impact on your on your reputation as a healthcare entity. And of course, civil. What's one of the other things that you have to watch out for is civil penalties, because right now, due to the HITECH Act, civil penalties for willful neglect are, they start out at $250,000. If it's a repeat offense and it's an uncorrected violation, this can extend up to $1.5 million. So any provider that is expecting to participate in the HITECH incentives, which there is also incentives to encrypt your data, to put up security, all of your security, is if you have a breach, then you're no longer eligible. So you need to make sure that you take all precautionary steps in order to do that. One other thing that we want to just touch on is that the HITECH Act now applies to HIPAA provisions directly to the business associates. And I know you all have business associates agreements. Formerly, privacy and security requirements were imposed on business associates via contractual agreements with covered entities. And as we've noted elsewhere, we suspect that many small providers do not have the requisite contracts, so your business associate agreements in place. And in some cases, the business associates agreements exist, but they do not meet the requirements of the HITECH rule. So under the lax enforcement regime of the past, lack of contractual agreements has apparently not provided problematic for the provider or the communities as whole, but this is changing because of the civil penalties that are in place now. Phil, this brings us to our second poll.
Okay, Tony.
You and have you put up our second poll.
Sure, no problem. I'll go ahead and launch that now. So how much do you intend to increase spending on security this year? And you can see the answers there. If you take a few seconds and answer that for us, we'd appreciate it. I probably think that in most cases, the customers that we speak to here at Centurion, almost yearly, they're spending more on security. Again, with the threats that are proliferating out there, it's pretty much a basic necessity. So I'll give a few more seconds, and I'll close the poll and share the results. Okay, go ahead and share the results. So it looks like half of you are not planning on spending any more money on security this year. About a quarter of you are going to be spending 6 to 10% more, and another quarter of you will be spending more than 10%. Okay, that's interesting poll results. We appreciate you taking the time to answer that. I'm going to go ahead and close this and hand it back to Tony.
Thank you, Phil. In fact, we're going to address that particular poll here in one of our 10 points on strengthening your security. And this really is probably the reason why you guys wanted to see this, is to get some pointers that we have collected over time and through not only our customers, but through various studies of what are the 10 plus 1 ways to strengthen your security. Number 1, have someone that is responsible for watchdogging your cybersecurity. So assign a designated security officer. Now, if you're a smaller organization and you don't have a C-level person that will take this on, this can be anybody. But it has to be somebody who is going to take the responsibility to go out there and look at what what are the newest malware that's coming out, how do we protect it, and by keeping a plan together of how are we going to make sure that our data is secure. Before you get started discovering on what you need to do, you need to kind of do an assessment. So run a risk assessment. Healthcare organizations must take stock of everything they own and use. In this case, it's not just whether the data is flowing well, but you also have to make sure that, once again, your PCs are secure physically. As we saw before, theft was the top ways that cyber criminals get information out of hospitals. They just go steal a laptop or steal a computer. Of course, now data is spread across a growing number of devices, which improves care, but at the same time, it increases risk of data loss and or misappropriation. And because many of the devices you purchase actually are online, going to say the Internet of Things, a lot of you're seeing more and more healthcare equipment is actually connected to the internet. So you have to make sure that not only are all your computers secure, but those Internet of Things that are out there that are gathering information and sending it are actually gathering the right information and sending it to the right people. Use strong passwords. I know this sounds, it kind of sounds redundant. You've been using strong passwords forever, but I was reading a study, and I can't remember right now what the study was, but it still said that the number 1 password in use today are the numbers 1 through 8. Second to that is still the word password. So as you know, you need to have some strong passwords going on. You need to make sure that you are putting a password change in every so often. A lot of systems now will do it every 3 months. In a high turnover environment, you may need to do that more often. So you may want to be able to get in there and just force change on a regular basis so that your people have stronger passwords. Next, BYOD, bring your own device. 50% of all healthcare organizations were not aware of the risks of BYOD, which is not very good because over half of all healthcare organizations allow some form of BYOD. And what's happened here is that because you are allowing somebody to use their device, they are on your network and they have no restrictions on how to use it. So by putting restrictions on how you use information on your network through a good BYOD policy, you can help restrict that information flow and make sure that it doesn't go where it should not. Secure your network. Hackers stole 4.5 million patient records from community health systems. This was through the Heartbleed internet bug, which was a flaw in a piece of VPN equipment. And because they didn't realize the flaw was there, cyber criminals got in, pulled 4.5 million records. It was one of the largest data breaches ever in healthcare. You should, as an organization, create an automated process to go and look at every piece of equipment you have, keep track of your users, make sure that passwords are up to date, ensure that every ex-employee no longer has access to any network data or equipment, and make sure that any new acquisition of equipment that you have is locked before you put it on your network. Work with law enforcement. This one's really come to light in recent time because the FBI and the Department of Homeland Security, after the community health system hack, pledged to continue efforts to educate healthcare organizations about potential threats. And they do this they have a monthly high trust meeting. And what they do is they look at what's going on right now. In fact, you can also go to the FBI's website. FBI actually has their internet security section has a really good system for sending out alerts. In fact, I'm on it. I get alerts every week to show what are the most prevalent of the malware that's out there that's hitting not only healthcare but anywhere in business. So work with FBI, work with your local law enforcement. If for some reason you would have a data breach or you would have a stolen piece of equipment, one of the first things to do is to alert the local law enforcement, because they will go ahead and alert the FBI. And as you work with them, the faster you can get that information to law enforcement, the faster you can close that breach. Number 7, this is what the poll was all about, is allocate a reasonable budget. I'm noticing on the poll there, about 50% of you said that you were not going to be increasing your budget. A Gartner report from August of 2014 estimated that globally security would be increasing this year by about 8.2%. You think about it this way. You balance an 8.2% increase in your security budget versus millions of dollars that are lost during a breach. So you have to say, well, what is a reasonable budget? Reasonable obviously is obviously within your means as a healthcare organization, but you also have to balance that against the cost. What would happen if you don't? So that's why I put that one on there. It is just a really good idea to allocate a decent budget. Next, use a multi-layered security approach. There is no silver bullet to this, guys. One of the things that people think is that, hey, I'm gonna get the best firewall that's ever been invented. Well, those are all great unless you have somebody on the inside that is leaking out information, or you have you got a 0-day virus that comes through and there is no definition for it yet. In fact, one of the things that Damballa researchers, they performed a test last year, and they looked at 55% of the best antiviruses, or 55 of the best antivirus products on the market, and found that 45 of these detected the Sinwall virus. Very common. It's a malware virus that is it's prolific, actually. It's everywhere, and it morphs on a regular basis. What happened was when they were running this test, they modified the Sinwall virus, and the tester was actually able to modify this literally in a matter of minutes and resend it back out through the same 55 antivirus products, and only one in 55 was able to detect a brand new version of the same virus that it just detected minutes before. So even though antivirus software coupled with anti-malware software is great and it's necessary and you have to do it, you have to have strong firewalls, it's not the only thing though. Because of the fact that these malware pieces are morphing on a daily basis, every day is basically a 0 day. So you have to have a multi-level system in order to catch. If one system doesn't catch it, the next one will try, and hopefully you have enough layers that whatever is getting through doesn't get all the way to your data. 9, educate your employees. People I talk to on a regular basis in healthcare say, hey, we've got classes, we educate our employees regularly. One of the things I ask them is, do you educate all new employees on your cybersecurity? And about half the time they say, well, yeah, that's part of onboarding. The other half are saying, no, we do this once a year. Well, sometimes once a year is not enough, because it takes real training to get your employees not to click on that socially engineered email that came through. And sometimes it's not even lack of education from your employees. Sometimes it is just that the socially engineered email is that good. What happens is these folks that are putting these together are getting better and better at it. Social media is one of the things that is it's been great for cyber criminals because people put their lives out on the internet through Facebook or Instagram or whatever, or Twitter, and that gives the cyber criminal an in. It allows them to find bits of information about a specific person, a targeted person, that they then craft a socially engineered email, embed a link, put that kitty picture up there, and then send it. And that, unfortunately, is how some of these major data breaches, in fact, the Anthem breach started out with a spear phishing campaign. The big bank scam in Europe, that started out with almost 4,500 specific emails going to different employees of multiple banks, and that's how they got in. So educate your employees. Once your security system is up, it's established, don't stop. Test it regularly. Test the system, including testing your employees to see if they remember their training. Use a group, because you can use a group that does penetration tests. These consultants that actually go out there, they're white hat hackers, will go out and try to get into your system and then give you a results report as you finish up. And one of the things that's coming up more and more is people they have just little tidbits of information about one of your employees. Sometimes that's from somebody, you talk to them on the phone. Sometimes it's through Facebook or whatever, but that is still the main way that these cyber criminals are getting into your systems, is through your employees clicking on a link. And last, but obviously not least, is close the gap between the keyboard and the chair. And closing the gap between the keyboard and the chair is the hardest part of securing your network, because no matter how well-trained your people are, how good your antivirus and malware is, there's always that new threat. And once again, I talked about the spear phishing, is once you've got everything in place, you're still at risk because somebody in your organization might just click that link. Now this is where we come to how we can help. Centurion Technologies SmartShield program can help, because no matter what, and here's a good statistic for you, if you're going to talk to the board about, hey, I need one more layer of security, 23% of your trained personnel will still open a phishing message, 11% of which will click the attachment. So no matter what you've done everything you possibly can, you're still going to have some penetration. Wouldn't it be great is if an employee makes that unwanted change, or malicious activity in this case, and all you had to do was reboot it to start it over and then wipe that clean. And that's what SmartShield does. It is an endpoint protection program that will wipe out any change on the hard drive as soon as you reboot. So if somebody clicks on the link, that kitty picture now turns into be malware, even if it turns out to be CryptoLocker and they see it, if they reboot, they can get rid of it. Now, SmartShield is also not only part of your multi-layer protection against your fishmongers, but it also helps you keep compliant with both HIPAA and HITECH, because this is one more layer and one more thing you're doing in order to secure your PHI. And by wiping out any errant information upon every reboot, and just think about how many times somebody different logs into a computer at a nurse's station, or even on one of your carts that goes room to room. If every time a new person logged in, it was pristine, clean, never had any, it was like it never had anything on it, wouldn't that be a great satisfaction to you and a great time saver for you? Because that way you're not having to chase this down. That concludes our presentation for today. I want to thank all of you for attending. I want to thank Phil Simeone, my cohort here, who has been diligently running polls. I'm going to leave this open for about another couple of minutes to see if anybody has any questions. So please use the chat function. Go ahead and send us a question. But I'm going to let it go for just a couple more minutes, and then we'll conclude. Please, if you like the presentation, please go out. It will be on our YouTube page, We'll also have links there to both Twitter and our Facebook pages. So please like us on Twitter, like us on Facebook. In fact, we are running a 10% off your next purchase of SmartShield if you follow us on Twitter or LinkedIn or Facebook. Thank you very much.